To measure waist to hip ratio, you're going to take a tape measure at the level of the belly button just above the iliac crest, and you're going to line it up like so, not too tight. And then for the waist, you're going to measure at the widest part of the buttock and measure again, and that's it. Anatomical position is feet flat, just under the hips, arms by your sides, and palms forward. Superior is above and inferior is below. The humerus is superior to the ulna and the wrist is inferior to the elbow. Okay. Anterior is in the front and posterior is in the back. An example of this is the clavicle is anterior to the scapula and the scapula is posterior to the ribs. The medial and lateral is if it's closer to the midline for medial and away from the midline it's lateral. The ulna is medial to the radius and the fibula is lateral to the tibia. Proximal is closer to the torso and distal is farther from the torso. So an example of this is the olecranon is proximal to the head of the ulna and the ulnar notch is distal to the head of the radius. Superficial is near the skin and deep is near the bone, so the gastrocnemius on your calf is superficial to the soleus and the soleus is deep to the gastrocnemius. The three planes of the body are the sagittal, frontal, and transverse planes. The sagittal plane divides the body at the midline and the frontal plane divides it into anterior and posterior, and transverse plane divides it into superior and inferior. The axes of rotation on the body are the mediolateral, antero-posterior, and superior-inferior axes. The antero-posterior axis has movements like shoulder flexion and extension. The mediolateral axis has movements like abduction and adduction. The superior-inferior axis has movements like shoulder shrugging for scapula, elevation, and depression. Center of mass is where these three planes intersect. Motions in the sagittal plane are flexion, dorsiflexion, plantar flexion, extension, and hyperextension. Motions in the frontal plane are abduction, adduction, elevation, depression, deviation, inversion, eversion, and lateral flexion. Motions in the transverse plane are rotation to the left and right, internal rotation, external rotation, protraction, retraction, and pronation and supination. Motions in multiple planes are circumduction, pronation of the ankle, and supination of the ankle. An open skill is unpredictable. In team sports like football, the players are adapting to their changing environment and are spatially aware. An example of this is like when a pass is thrown. A closed skill takes place in a stable and predictable environment. An example of this would be a free throw in basketball because it is self-paced and it follows a clear and predictable pattern from beginning to end. Translation occurs if every line segment on the body remains parallel to its original direction during the motion. When all points move along straight lines, the motion is called rectilinear translation. When the paths of motion are curved lines, the motion is called curvilinear translation. Rotation about a fixed axis moves along in a circular path in the planes perpendicular to the axis of rotation. General motion is when the body undergoes both translation and rotation. Translation occurs within a plane and rotation occurs about an axis perpendicular to this plane. Serial skills are a group of discrete skills strung together to make a new and complex movement. For example, the sequence of skills for the triple jump. Continuous skills have no obvious beginning or end. Simple and complex kinetic chains are the notion that these joints and segments have an effect on one another during movement. When one is in motion, it creates a chain of events that affects the movement of neighboring joints and segments. Ready? An open kinetic chain is when the distal segment of the extremity is free to move in space. For example, waving a hand or moving a foot during the swing phase of a gait or doing seated knee extensions. The definition of a closed kinetic chain exercise is when the distal segments meet considerable external resistance that prohibits free movement. Therefore, this is a system where neither the proximal nor the distal segments can move. Movement at one segment in the closed chain produces movement at all of the joints in a predictable manner. For example, during a squat, the movement at the knee joint accompanies movement at the hip and ankle joints.